Perfect. So welcome back to the 1760 sessions where we talk to founders building systems and impact. I'm Harry, as you know from many other podcasts. And today I'm joined by the fantastic Dr. Jaime Ponce, founder of Weight Loss Center Chattanooga, a comprehensive weight loss practice that's transformed 700 lives in its first year by integrating, apologies if I say this wrong, bariatric surgery, medication management, and lifestyle support into one seamless patient journey. So rather than treating weight loss as a one-size-fits-all solution, Jaime and his team address the root causes, introduce nutritional literacy, lifestyle habits, and long-term follow-up to help patients achieve sustainable results. Jaime, I hope I got that right, and thank you so much for being here.
You did. Yeah. Thank you, Harry, for inviting me. This has been a great start of the conversation. I think you say it right. You know, our mission and our goal is to address obesity, as we know that it is a chronic problem that happens over lifetime. It doesn't get solved with one therapy. We're talking about people that have achieved a degree of obesity, which is very difficult just to manage with one single thing. And so, yes, you can start with diet, lifestyle modification. Sometimes people require additional medications as a tool to help them with the hunger. And now we have the best medications available, which are the GLP-1s that many of you probably have heard about it. And then some patients may require a little bit more intense therapy because they have gained more weight and they have developed more what is called metabolic disease, meaning that their obesity is damaging their organs and is creating diabetes, high blood pressure, sleep apnea, damaging the liver. There's a disease that is known as fatty liver, but it's also known as metabolic fatty concentration in the liver, damaging the kidneys. And so all those patients may require metabolic surgery, which is called bariatric surgery, the word that you have hard time to pronounce. Patients do great, you know. I mean, actually today, that's what I did today. You see me here in my OR attire, a little bit cooler here inside of the hospital. But what it does is the technology has advanced so much, you know, Harry. I'm telling you, now we can do this minimal invasive with a small incisions, with a small video camera, a small instrument. It can be done either with a robot or with laparoscopic instruments, which all those are very small instruments. And then you can see patients after the surgery walking, drinking. Many go home the same day, many go home the next day. This didn't happen 25 years ago. 25 years ago in the 90s, people were having a lot of open surgery, open meaning an incision in the belly, and they had more problems, more complications. Nowadays, the surgery is as safe as a gallbladder surgery.
Yeah.
And so, but you know what? The problem is that is one of the most underutilized therapies that we have for what we consider a medical problem. When obesity is creating all these problems, you know, people honestly are a little bit afraid of surgery, and that is okay. But to tell you the truth, you know, nowadays it's as risky as a gallbladder surgery. So many people have gallbladder surgery. They need to think it that way.
I think it's probably just from my own experience, but not my own experience, just my own knowledge of the weight loss area. It's that sort of, you're potentially scared to talk to a surgeon because you're thinking, what are they going to do? Just rip a load of fat out my body, but not actually get to the root cause of the problem, which you and your team are doing.
Exactly. So many people have that misconception that surgery is just going to take the fat out. No. What we do, you know, is we make some changes in your stomach that is actually going to block one of the hormones that makes us be hungry. That's number one. You're going to be less hungry. Number two, we're going to stimulate the production of a hormone that makes us be more satisfied, which is GLP-1, same one that is in injections. Number three, the surgery is going to improve your metabolism. So, wow. So imagine a patient that is struggling with their metabolism. They're storing more calories and they have more difficulties to lose weight and they're hungry all the time. They never get satisfied with a plate. That's a tool. In addition to that, the stomach is smaller in capacity. And so even when they eat, they cannot eat as much. Big change.
Okay, wow. That's a huge change.
That's a huge change. And so if you add that in a comprehensive center in which you're going to visit a dietitian and you need to teach everybody how to eat with this tool, the success is tremendous because it's not only about the surgery, but it's also about making the changes in your lifestyle to make the surgery work better.
Yeah.
Now, everybody will say, well, why don't you just make the changes and don't do surgery? Well, because these patients have tried and they haven't been able to do it. They have just more weight to lose than what diet and exercise will do for them. So what we teach them is reading labels, eating more protein, eating less carbs, eating more slowly, chewing very well. I have this thing that you're going to laugh at me, but we call it the rule of 20s. So we tell
Okay,
patients,
tell me it.
a rule of 20s has 320. So it's how patients need to eat. So we tell them to
Yeah.
take a bite and chew it 20 times each bite, first 20. Put the fork down 20 seconds in between each bite and stop eating at 20 minutes. So 320s. Now patients tell me, wow, I never thought about how fast am I eating. I'm eating much faster than that. And so this is the pace of how they're going to be eating after surgery. And in 20 minutes, this is how they're going to feel full with that plate after surgery.
I'm learning something myself here because I am very guilty for absolutely wolfing down my food and eating.
That's the problem. And then you don't give a chance for your stomach to send those signals that you are getting satisfied. Now, one of the things that you touch, Harry, is why did we decide to put this independent center with all the tools in one place? Is because we see over and over, this is not today, this has been happening over the years. Hospitals on one side, they get more focused on surgery because that makes them money. I mean, that's just natural sense. And we're talking about United States, but it also happens in England. It also happens in other countries. Hospitals, they just need certain kind of business to make money. And then there's these shops, these weight loss centers, weight loss clinics, weight loss little shops in which they offer the medications like they were offering drugs. And it is what it is. And so patients, they don't know better. I mean, they're just going to go and look at the internet and they say, well, I'm going to go with this surgeon and the surgery. Well, I'm going to go with this clinic medication. Well, they're not really looking at the patient individually and tailoring the management for that patient. And believe it or not, many patients, they may not need surgery. They may not need medication. They may need both. They may need a combination. And sometimes we start with medications first, get them to a response. And then when they need to lose more weight, then may need surgery and vice versa. Some patients start with surgery because they have a higher BMI, and then they may need also help with the medications to continue to maintain over time a little bit better. The dose of the medication is very different in those scenarios because one is for maintenance, the other one is just to trigger weight loss. So having that comprehensive center with a dietitian, with psychology support, with lifestyle changes, we have access to exercise therapy. So remember, these patients are not like you, Harry, that you probably go out and run and jump in the mountains and do all the stuff that you wanted, isn't it? What sport do you like?
Running.
What sport do you do? Do you do a lot of running?
I try to do one long distance race a year. For example, London Marathon next year. I did the Ibiza Marathon this year, and then I tend to try and go to the gym about 4 times a week or so.
So these patients, and you will tell these patients probably, just do what I do. Do a lot of exercise. But these patients have reached a point in which is very difficult. The mobility is very difficult. Try to do the running, their joints are already damaged because the problem is that the weight that they're carrying is damaging their joints. The other thing is asking to run a marathon, that's not going to happen for them. Or asking to go to the gym, they're intimidated because everybody looks so fitted and they don't feel comfortable. So there's also that sensitivity issue that they don't feel as good. So what we do is take them to a place in which they're going to feel more comfortable. They're going to be instructed to do and learn how to do the activities that they can do. You know what? Walking in a pool is much better for the joints on them because they're not putting that pressure. So just simple walking in the pool, you can take it into water aerobics, which is doing a little bit of activity in the pool. That takes less pressure there. Other exercise, upper body exercise, things different for them. So with time, you'll be amazed. Some patients come and tell me, I run a K for the first time in my life. It's a huge progress. Before they were being very short breath, they couldn't even go up in the steps. And it's just, big improvement over time.
So what I've loved learning about your organization so far from this conversation already and from our previous conversation, that literally everyone you speak to, it's a case by case basis. There's no one result for each person. And then secondly, as I've realized, it's a huge amount of education. So I always thought the main education piece came in at the very end when you're teaching someone how to, essentially you're wanting them to carry on these healthy habits that mean that they won't slip back into their old habits. But I had no idea there's this whole first up education where people might not know which part of your offering that they will need at the start. And that's for you to uncover on this case by case basis.
Yeah, the nice thing about us being able to offer everything is that we educate them on all the options, but we also educate them on how they need to change their lifestyles. It's amazing that people don't know how to read labels in the food, how to shop in the grocery store, how to put the portions of food in the plate. So we work with them on the right portion size. Many people don't understand what's a portion, what's the right portion of food. So there's a lot of instruction that they get, and they love it. We have a dietitian. Her name is Mary. She's so animated that people just love to talk with her. I mean, it's just that because she understands if somebody doesn't like certain type of food, and then she comes up with other idea of protein that they need to get. And then Brooke is my nurse practitioner. She's been working with me for 24 years. But what I did is I carve out people that have a lot of experience, and we all got together. I have a psychologist that is awesome. He's working on weight loss for more than 20 years. I got him out of retirement. He was going to go retire and said, listen, you just need to help us because I have this idea. We're going to put everybody together in one place. And with that, then we hire more people, hire nurse practitioner, the instructor. So because you have lined up people that really want care. And I'm sure that we're not the only ones that had lined up people to look for example, for the GLP-1s. It's just a high demand. In the United States, I think their estimation is that 1 out of 8 Americans have tried the GLP-1s at some point. So that's a lot of people.
Yeah,
1
it is.
out of 8 Americans have tried. And if you think about it, according to the companies, have in 1 year they have sold about 8 million prescriptions, individual prescriptions. Like per individual patients that have tried the medications. The problem with that is that if they don't have that comprehensive management, 50%, half of them at 1 year, they quit taking the medication. And you know what? It's not because the medication doesn't work. It's because it may not working as good. They may get symptoms. Nobody's supervising them. It's too expensive. They don't have access. So there's many issues that they don't know how to work. So we can also work with the insurance of the patients. We can work with the cost. We know how to. This is what we do all day. This is what we do. It's only from the financial standpoint, we're going to try to help the patients to get not only the best treatment, but the treatment that is more affordable for them.
So what I wanted to do next was potentially wind it back, because it's obviously a fantastic model that you have operating at the moment. But what actually inspired you to launch it and take this sort of integrated approach to weight management? What was the sort of moment when you were like, hang on, this is my calling?
So we've been talking about this for years. The hospitals, they have tried to help us to do this, but they don't like to invest on things that quote unquote don't make as much money or is costing them money. And they see the money in a different way, unfortunately. And we learned that today is probably the best time in history that we have to take care of obesity, because we have better tools. We have better tools in surgery, but we also have better tools in medicine. And so if you think about it, if this is the best time, let's put all that together in one center. That idea was not as strong 3-4 years ago before these GLP-1s. And now that we have all that together, me and my staff, we talk about it and we say, let's do it. Let's do it, because with the hospital, we're not going to be able to do it. And we are losing ground if we just let all these clinics around it take care of these patients, not necessarily in the wrong way. I'm not going to criticize them, but they only have one choice. So when you have a nail, you only are going to use a hammer to shoot the nail. So no, we're going to have more tools for these patients to take care of them. All the tools available. And today is the best time to take care of obesity. And remember, if you put obesity, this is my slogan. So if you put obesity on the top, you take care of all the other problems. So diabetes, high blood pressure, sleep apnea, quality of life, improvement of their employability. So easier
mental
to find
health,
a
there's
job,
so much.
mental health. So there is so many things that they improve. Fertility. I mean, you have these young girls that are struggling with getting pregnant because they've been told that because of their weight, they have polycystic ovarian syndrome and their infertility. As soon as they lose weight, they become fertile and they have babies. And so this is happy life. Patients that tell me all the time, Dr. Ponce, I never had a guy that opened the door for me. Simple things as that, it's kind of sad, but it is happening. It was embarrassing when I fly. I have to ask for a seatbelt extender in the plane because just the seatbelt didn't close.
Small things like that impact a
small
lot.
things. And then they're shy. They're I mean, these are very intelligent people, and the only thing that they feel like they have failed in life is just keeping their weight off. And it's because they got to a point in which is taking over their body. I mean, the disease is just taking over. They cannot control it. You know that if I put you on a diet, you, Harry, your level of hunger hormone, there's a hunger hormone that is called ghrelin. Your level of hunger, this has been done in experiments, goes this high. If I put a patient that has 200 pounds overweight on a diet, the level of hunger hormone goes 3 to 4 times higher. So they're fighting against a bigger enemy. Now, you may tell this patient, you just eat less and do exercise and you're pretty fine. But for them, it's more difficult. One, because they cannot do activity because they're more heavier. And two, because their hunger is rabid. I mean, they cannot control it. And so they already have a level of metabolism, a disease that is out of control. The surgery, what it does is reset these things. I'm going to give you the same level of as you have, and then let's change the environment. Now that you have better control on the hunger, change the way that you do things so you can maintain that. Nothing is perfect. I'm telling you, if you do that approach and you have the right people in one center, it's much easier for the people, for the patients to get the help for the dietitian, and the mental support is also important.
They don't have to go and search for it elsewhere. It's just on your doorstep and part of probably the entire package that comes with it.
Exactly. Can you imagine how many times a patient tells me, well, Dr. Ponce, every time that I sit down and don't watch TV, I always wanted to have something to eat in my hand.
Yeah.
So even if now they're not hungry after surgery, they have a smaller stomach, the mental aspect works against them because they sit down and watch TV and they wanted to have something. It's like a smokers that trying to quit smoking, but when they're doing something that always wanted them to smoke, they wanted to grab something in their hands. And so the mental aspect is also important.
I can understand that completely. When I've tried when I tried to quit smoking in the past and I've smoked and not smoked, I find if I have something on my face, so combing my beard was one way to cognitively in my brain get over the function of having something smoking from my mouth. I can understand that. In your year one, I think you mentioned on our last call, I think you had something around 700 new patients. Do you want to touch into that a little bit? Because I think that's a remarkable amount of patients.
We were saying, what's the volume that we can handle? How many patients can we? I mean, we seen a lot of patients. We had a tremendous success. Of course, we've been in town. They know our name.
Yeah.
But it takes some doubts in your mind. You say, well, the people are going to come and see us independently. And so what I did is, and let's sit down and use all of our best resources. Right now, everybody's watching social media. Well, let's use social media to let the people know in town that we are the same people, the same team with this large experience, but now we are all together independently. We're the same people that were in that hospital. Now we're here independently. We're the same people that can go to all these places, but now independently. And we did that. And then our patients, I start talking to the patients and say, you can help us. I mean, former patients that find us. You can help. You are one patient that came and see us and had either surgery or medications. There's another 90 plus patients that are sitting down at home doing nothing. Why don't you help us to tell them that? And they help us.
And what is this? Through client testimonials?
Testimonials, real, honest testimonials. I say, I just want you to tell us your story. Tell us what make you come to us. And all that, created tons of, you can see the likes on, and trust me, I'm not a one of those guys that say, I wanted a lot of likes and I wanted a lot of these things, like I see my kids doing that. But you can start seeing that followers and the people, you can tell that people more than what you think are struggling with obesity. In United States, 41% of the Americans are considered to struggling with obesity. It is estimated that by 2030, that's only 5 years from now, close to 50% of the Americans are going to be struggling with obesity. Wow. So we have a problem.
Well, for me, visiting America often as I have done, I always find it's the portion sizes. It's very different to in the UK.
Yes. So we have a problem with portion sizes. We have a problem sitting down a lot. We drive a lot. There's less walking. The cities are not designed to walk. They're designed to drive. There is just the culture there. And then if you look at United States, there are places that eat quote unquote healthier food. And then there's where I live, the South of United States, they like the fried chicken, they like the
Yeah.
fried food, they like the very high calorie diet. Nothing bad about the taste of the food, but it's high calorie food.
Yeah.
So, and then you start getting into the genetics, and it's amazing. There's well-known studies that if you have one parent with obesity, there is about 1 out of 3 chances that your kid is going to suffer from obesity. But if you have 2 parents with obesity, that jumps into 10 times
Straight away
higher the
trouble.
chance of obesity. So it is very difficult because it's not only the genetics, but it's also the culture where they grew up. The other genetics that people don't get it very easy is, for example, we have a lot of immigrants in the United States.
Yeah.
Over years and over generations. So if you bring, for example, and this is true, if you bring, just think about it, an African American that stays in Africa, they eat different kind of food that when they come to America, correct? And as soon as they come to America, they gain weight much faster because their body is used to
Unused to it.
store more because they have less of that rich food. They eat more fiber, they kind of do more activity. When they come here, their body is not learning that you change that. And so it's still learning to save calories and they gain more weight. That also happens with Native Americans. They develop diabetes much faster and obesity much faster. So there are some cultures that have more difficulties with the American culture. Not to take it, everybody that comes to America, I'm originally from Mexico. When I came to America to train, in 2 seconds, I gained 20 pounds. What is it? 10 kilos, so it's just like, whoa, in 2 seconds, just by, well, what am I doing? Because what? Every time that we have a break when I was training and what they have for eating pizzas, this and that, and so cookies, and it's all about the types of calories that you're getting all the time.
Incredible.
So it's amazing.
I'd never even thought about it like that, specifically with people coming from different countries and bodies not being used to it. You mentioned one way of spreading the business is essentially through client testimonials and people having gone through a transformation with you and pushing out their stories. So what are your main patient acquisition channels at the moment? Is it referrals, insurance networks, digital marketing, or just simple community outreach?
The 2 biggest source of patients is word to mouth. So a patient telling another patient or 2 patients, and social media.
Okay.
So social media
organic
or
active marketing.
organic, like many of them, they say, I was looking for something and I just Google you, or you pop up in my social media because I was looking for weight loss, and it just continues and continues. Now it is tremendous. I can tell you that I was celebrating with my staff our first year because we have a lot of wins on our first year. In our town, we're number 1 in Yelp from all the clinics that we have here. People are putting us there because they rank us. We have 100 and something Google reviews, 5 stars, because people are treated well, are enjoying the environment. They feel that we understand them. This is another thing. So when these patients go to doctors, sometimes it's embarrassing when the blood pressure cuff doesn't even fit on their arm because they have a big arm. When their chairs, they're afraid of sitting in the chair because they're going to break the chair, or they don't fit because they have the handles on the chair and their hips or their body is just bigger than the chair itself. So we have the sensitivity. It's embarrassing when they get into the scale and the scale only measures up to 350 pounds and they weigh more than that. And so we have the right scale, the right blood pressure cuff, the right
You've got all the best
sensitivity, and everybody's going to treat them with the right sensitivity, understanding where they're coming from, not judging them, not telling them you're wrong, you just don't do the things right. No, we understand where they're coming from. And so they all feel welcome. It's like a family. They all feel welcome. And so it's not only us creating awareness in social media, but you have to create awareness, but you also have to do the right thing at home. And so how do you get the staff to buy in to treat a patient with respect and sensitivity? Give them a portion of the business. They need to be part of the business so they can all be together aligned with this.
I can see how that ties into the word of mouth thing so well.
Yeah. Even if you are the nicest person in the world, Harry, it's good to have a financial incentive to do what you do. It's good to have, this is our world, and you need some incentive to dress well and to eat and to do your stuff. I
Yeah.
mean, if you like to run a marathon, I mean, you have to train and you have to buy your tennis shoes and you have to do the stuff that you need to do. So all those things are important for everybody. Everybody has their needs. And I think if you treat well this valuable stuff, I mean, because I got it, you need to make sure that they are embracing the business. It's part of them. If they get a Google review that is 5 stars, you celebrate them. You tell them this is for you, for your staff, for your staff. Maybe even you compensate them as a bonus and then keep embracing that idea, or keep doing
Yeah, I
the
love
good
it.
job that they're doing. So it's all a matter of I mean, I love it, which is patients come in and bring us a patient bring us this big clock to put it on the wall with a picture from the internet that she pulled from all of us. She gave us to us.
Yeah, amazing.
Or a patient comes in and says, I think this wall needs a little picture. Yeah, I'm going to give you this. I mean, they don't have to do that. They
Yeah,
also
no.
feel like the house that they're going, this is the house that is taking care of them, and the people, the family is taking care of them. Now they feel like they can intervene and take care of the office. They don't do that for a regular doctor's office. They don't do that for I
No.
mean, I have my gallbladder out, they take it out, and so, okay, see you, bye, doctors. Thank you very much. I mean, they don't go back and tell them, hey, you need this on the wall, you need this on this, you need this. These people feel like this is their house because we are
Yeah.
making them feel that comfortable. So we
I love that.
have this in our mind. This idea is coming into reality. And trust me, it's just a matter of continue to do the good job that you're doing. Word to mouth is number one. Number two is social media. Of course, we still get referrals from doctors and we still get referrals
Yeah.
from
Where
other
where do you
people.
feel like there's the most untapped potential, maybe?
Oh, and top potential is doctors. I mean, like primary care physicians, they're so busy taking care of many patients. And you know what? They take care of diabetes. They take care of high blood pressure. They take care of bone and joint pain. They take care of reflux. They take care of all these medical problems. And 40% of their patients are struggling with obesity, maybe more, but they don't talk about weight loss. The reason that they don't, there is a good statistic that says that only 5% of our primary care physicians tell their patients that they need to lose weight and then tell them how. And the reason they don't do it is because they're going to feel like the patient gets offended. They don't know how to do it. They're sensible. And there's a way to talk. Even if you're not on a weight loss center or you're not a weight loss specialist, there's still a way to say you ask permission first. So this message goes to primary care physicians. You ask permission, you're in front of the patient and tell them, hey, do you mind if we talk about one of the reasons why you're developing type 2 diabetes, maybe your weight? And so I wanted to ask you if we can talk about things that we can do to solve this problem. Just like that. You don't have to feel like that patient is going to get offended. And many patients may be receptive, more receptive than what you think. And many patients may be that may be the first touch that they had in their life because they don't know anybody that had treatment. They don't know anybody that has seen with us. And they don't use the social media as much. But then when the doctor tells them, they listen to the doctor. So that's the most untapped because referrals from physicians are always smaller and they could be bigger
Yeah.
because they see the most patients that are struggling, and patients listen to their doctor. They, for the most part, not everybody. In America, we have this thing about patients listen to Dr. Google first before the real doctor.
Yeah, of course. It's probably Dr. ChatGPT now as well.
Or Dr. ChatGPT now, which
Yeah.
is amazing. But I think AI is a revolution. But if it's misused, you're gonna get into trouble. At this point, it's better to allow the AI to refine a little bit better how and what we're gonna need to do it. We believe that AI, artificial intelligence, is gonna help so much in the future.
Yeah. So looking at business operations, as you've brought up AI and 1760 is an AI company.
Yeah.
Have you ever used or thought about using automation for maybe AI appointment reminders, educational content to be pushed out to, say, your list of people that are ready to be booked in for a consultation, or used it for follow-up sequences?
Yes, we use AI for follow-up reminders. We haven't integrated. So I saw one doctor's office that the AI basically answered the phone with the doctor's voice.
Yeah, AI receptionist.
And it's almost like a receptionist, but it's the doctor's voice, AI, and it starts scheduling things. So I think that's
Okay,
the future,
amazing.
to start integrating more of that. But I think the other level of AI is going to be when you get this profile panel. For example, you get a patient you put it on a body composition scale, and then you see the percentage of fat, muscle, water that they have. And then you look at blood work and you see the metabolic panel, the percentage of lipids, blood sugar, and everything else that they have. And then you put there the weight, BMI, and then the AI will give you not only the options, but even the numbers of efficacy of each treatment and how the treatment can be balanced. Patients are going to be able to, patients, and if you put it on nice graphics for patients visually at a 6th grade level in which people would understand it very clear.
You spoke largely about patients potentially being embarrassed to talk about these kind of things and having the option to communicate with an AI bot probably sometimes might be less embarrassing, so to speak, for them. I can understand why that could maybe benefit.
Yeah, we need to make sure that and AI is smart and intelligent, but when you do understand that AI, it has to be tailored to be sensitive enough for this patient.
Yeah, of course. So if you could automate one thing within your organization tomorrow when it comes to maybe a manual task like appointment confirmations, insurance verification, follow-up call, nutritional education, whatever it may be, what would it be, do you think?
I think what I would create is a automation that allows them to have in their phone immediately a list of to-do list that we need to take care of them, so we can establish a plan of action and then follow it. And so if you start from the beginning, reminding them not only about the appointment, that's an easy task, remind them of the appointment, but then embrace them into the plan and put their plan comes up with their phone. And remember that you need to drink your 60 ounces of water a day. Remember that you need to follow the rule of 20s. Remember that you need to do your 30 minutes of walking every day. Remember that you need to eat your protein first. Remember that you need to, and so all those things come up like the watch reminds you how to stand up every hour, correct? That's just one reminder.
Yeah.
If you get a lot of these,
have everything that can be implemented that can already be implemented for people, definitely. Maybe your patients, who knows? Well, definitely something that's been done in the future, done in the past. But I've realized that we are kind of at time now, and I feel like there's about a million more questions I had to ask you. But I think that the most important question I want to ask, because we've learned so much today, I want to know, what's the next, say, 3 to 5 years look like for Weight Loss Center Chattanooga?
We're going to keep growing according to what I know that it is in the pipeline. The future for treatment of weight loss, of obesity, is so bright. We're going to have more and more tools in the next 5 years. I'm going to tell you something. I've been in meetings of how, for example, surgery is going to be done 25 years from now, how medications are going to be available, and the power of the medications in 5 to 10 years from now. So if you combine all that knowledge and all the medications that are on the pipeline and all the technology that is on the pipeline, now we have robotics with AI. Think about it. So right now, we do surgery with a robot, but we manage the robot. The robot is not intelligent enough to manage himself. Robot is just a word, because I manage the camera, I manage the instruments, and I sit down in a console and I move everything else. Can you imagine if that robot is already learned? So the new robots right now, they have the NVIDIA chips, they're learning AI, they're learning from all the cases that are being done around the world. And so eventually they're going to capture certain types of surgeries, and the robot is going to be able to do a case and even face a distraction, for example, a bleeding, a different anatomy, like a car, like a Tesla car can identify the traffic and identify different things. It's going to identify different situations by the things that it's learning. And you're going to have a surgeon sitting down, watching a robot doing 1, 2, 3 cases, and then intervene when the robot kind of doesn't know what to do, correct? But with time, the robot is going to understand as soon as you teach them what is the next step and the next step. So can you imagine if you integrate all that now with medications as well? Your patients are going to have very good intervention, because it's going to be systematic. It's going to be this patient with this BMI, with this overweight, with this minimal disease needs this, versus this patient with this more disease needs that. The future is going to be bright. We're going to have medications very strong.
Yeah, it sounds incredibly, one, incredibly believable, and two, little bit scary, but for me, it's going to be the future. It's going to be teaching and learning, and then the robotic side of things is going to.
But just think about it.
Yeah.
If somebody is in the Antarctica, and then it's winter time and they're blocked on traveling and they need surgery, you're going to be able to do that by you sitting down in the United States or in England with another physician there putting the instruments, not having a lot of knowledge, but just enough to put the instruments in certain portions of the body, and then the other surgeon can do it at a distance. Or when we have a colony in Mars, same thing. I'm going futuristic, but you, Harry, are going to see that. You're going to see a colony in Mars at some point.
Yeah, probably.
In your lifetime. So it's so fun to talk about all these things because, trust me, I've been in conferences with Google health people that are very experienced, Amazon health people that are just in the latest technology. And they tell me, this is not unreal. I mean, a lot of these things can be done. What is the biggest limitation that we have in the United States is the liability, the legal issues.
Yeah.
How can you do stuff without the lawyers telling you that you cannot do it?
I've learned that from a lot of people in the US that it's ridiculous now. You can't do anything. You can't even have a step in a bar in case someone falls over it. Is so much.
Exactly.
Jaime, this has been inspirational. I've absolutely loved every minute of it. It's fantastic to learn about the space that you're in, the potential for it to grow, and how your organisation is doing and where it stemmed from. And then even learning about the patients that you look after. Really, so much I didn't know before coming into today. And I just want to thank you so much for your time. And I would really love it if we could get you back on here at some point.
Excellent. Let me know, Harry. And I enjoy talking with you. Thank you for reaching to us. And if you are around in Tennessee at any point, let us show you what we have, and then we can go from there. Okay?
Amazing. Thank you very much, Jaime.
We'll see you. Bye-bye.